Carpal tunnel surgery is done under local anesthesia. You don't have to be put asleep for this operation. So consequently, you'll be able to go home the same day. So before you leave, we'll make sure that you understand your follow-up appointment, your medications, your activity restrictions, and what to look for with any other risks. Generally speaking, patients can tell a great decrease in the amount of pain that they had before surgery. They'll still have some achiness from the incision, of course, but it's not very much at all. Many times people can already tell an improvement of their sensation right off. And strength, however, takes a while to come back, but we'll work on that with physical therapy when I see you back. We'll arrange a follow-up appointment, which is generally in about 12 to 14 days, and I need to see you back to take your stitches out. You will have one layer of stitches deep to the skin inside, and that'll be there forever. And then you'll have one layer of stitches on the outside, and those need to come out. Now, palmar skin is very, very specialized skin, wonderful skin, but there's a lot of dead layers there, and so consequently, palmar skin is very slow to heal. So during this time, you really need to be careful to keep your wound clean and dry. The expectation is that you're going to do very, very well from the surgery. If you don't do well, it's usually due to one of two things. Maybe your problem really wasn't a carpal tunnel problem, and maybe it was actually involvement of a nerve root coming down your neck into your arm, or perhaps the surgery didn't completely decompress the nerve. That is a much less likely scenario. Your return to work issues will be very important on your follow-up appointments, and it's highly variable depending what you do for a living. Generally speaking, heavy labor, for example, using wrenches or shovels, a lot of hand manual work, probably about 3 months, because I really need to let that wound heal up very, very well. But we'll work with your employer from day one trying to find another job for you to do, which is less than full duty. Those periods of numbness and achiness that used to wake you up at night, in the middle of the night, almost never recurs. The chance of this happening in the future is nearly zero. It can occur, but it's quite unusual. Generally speaking, just changing your physical activities for a while to make sure that you're not causing the problem will allow those symptoms to abate. The things to be careful of is obviously causing a lot of pressure on that area, because the ligament that was on top of the nerve, causing some protection to it, is now open, and so the nerve is a little bit more vulnerable to direct pressure on it. However, the vibration problems and the sleeping issues probably won't be as much of an issue. So you really want to try and avoid direct pressure, really where I'm touching on my hand right now. I hope this helps you understand anatomically what's happening with the carpal tunnel problem, makes you understand a little bit of how successful the surgery is. I've done hundreds and hundreds of carpal tunnel surgeries for carpal tunnel syndrome. The patients by and large do very, very well, and my patients generally tell me had they known that it was this simple, they'd have done it a long time ago.